Chapter 60, Introduction to the Musculoskeletal System. At the completion of this lesson, you'll be able to describe major structures and functions of the musculoskeletal system, discuss elements of the nursing assessment of the musculoskeletal system, identify common diagnostic and laboratory tests used in the evaluation of the musculoskeletal disorders, discuss the nursing management of clients undergoing tests for the musculoskeletal disorders. The musculoskeletal system consists of bones, muscles, joints, tendons, ligaments, cartilage, and bursae. It supports the body and facilitates movement. Other functions include storage of calcium, phosphorus, magnesium, and fluoride, production of blood cells in the bone marrow, and protection and support to the body organs such as lungs, heart, and brain. The human body has 206 bones. The bones of the skeleton are classified as short bones, such as those in the fingers and toes, long bones, such as the femur and ulna, flat bones, such as the sternum, irregular bones, such as the vertebrae. There are two types of bony tissues. The first is the cancellous bone, or spongy bone, which is light and contains many spaces. The second is the cortical bone, or compact bone, which is dense and hard. Both types of bones are found in varying amounts in all bones. Cancellous bone is found at the rounded irregular ends of long bones. Cortical bony tissue covers bones and is found chiefly in the long shafts or diaphysis of bones in the arms and legs. The combination of two types of bony tissue provides strength and support, yet keeps the skeleton light to promote endurance during activity. Bone is composed of cell, protein matrix, and mineral deposits. The three types of bone cells are osteoblasts, osteocytes, and osteoclasts. Cells that build bones are called osteoblasts. These bones secrete bone matrix, in which inorganic minerals such as calcium salts are deposited. This process of ossification and calcification transforms the osteoblasts into mature bone cells, called osteocytes, which are involved in maintaining bone tissue. During times of rapid bone growth or bone injury, osteocytes function as osteoblasts to form new bones. Osteoclasts are the cells involved in the destruction, resorption, or remodeling of bone. During growth, bones primarily lengthen. The diameter also increases when osteoclasts break down previously formed bone, however, making the central canal wider. When skeletal growth is complete, the osteoclasts, which are part of the mononuclear phagocyte system, continue with the remodeling of bones by balancing bone resorption with new bone cell replacement. Bone formation or reabsorption continue throughout life. The greatest activity occurs from birth through puberty. The layer of tissue called periosteum covers the bones, but not the joints. The inner layer of the periosteum contains the osteoblasts necessary for bone formation. The periosteum is rich in blood and lymph vessels and supplies the bone with nourishment. Inside the bones, there are two types of bone marrow, red and yellow. Red bone marrow found primarily in the sternum, ilium, vertebrae, ribs, manufactures blood cells, and hemoglobin. Long bones have yellow bone marrow, which consists primarily of fat cells and connective tissue. If the blood supply becomes compromised, the yellow marrow may take the characteristics of red marrow and begin producing blood cells. The image shown shows the structure of a long bone. So calcium, phosphorus, estrogen, testosterone, calcitonin, vitamins A, C, and D, growth hormone, exercise, and insulin all affect bone formation. If you estrogen and androgen deficiency, vitamin deficiency, starvation, diabetes, steroid use, inactivity or immobility, the use of heparin, excess parathyroid hormone, all can cause bone growth suppression. Question number 1. Is the following statement true or false? There are two types of bones in the body. The answer is false. Bones are classified as short bones, long bones, flat bones, and irregular bones. There are two types of bony tissue in the body. There are three kinds of muscles: skeletal, smooth, and cardiac. Skeletal muscles are voluntary muscles, impulses that travel from efferent nerves of the brain and the spinal cord control their function. Skeletal muscles promote movement of the bones of the skeleton. Examples of skeletal muscles are the biceps and the arms. Skeletal muscle is composed of muscle cells or fibers that contain several myofibrils. Sliding fillets called sacromills make up myofibrils. They are the contractile units of the skeletal muscles. Impulses from the central nervous system cause the release of acetylcholine at the motor end plate of the motor neuron that innervates the muscle. As a result, calcium ions are released, and the release stimulates actin and myosin in the sacromills to slide closer together, resulting in the contraction of the muscle. When the calcium is depleted, the actin and myosin fibers move apart, causing relaxation of the sacromeres, and thus the muscle. Muscle tone, referred to as tonus, is evident when muscle fibers are contracted. In order for muscles to remain toned, exercise is required. So these are some various muscle tones that may be described that you may hear or you may document in some documentation. So flaccid, a muscle that has no tone or is limp. Spastic, a muscle that has greater than normal tonus. So it's like greater muscle tone. Atonic, a muscle that is not innervated becomes soft and flabby. Hypertrophy is muscle enlargement that occurs when repetitive exertion over time. Atrophy is muscle deterioration that occurs with lack of use and exercise. So smooth and cardiac muscles are involuntary muscles. Their activity is controlled by mechanisms in their tissue of origin and by neurotransmitters released from autonomic nervous system. Smooth muscles are found mainly in the walls of certain organs or cavities of the body, such as the stomach, intestines, blood vessels, and ureters. Cardiac muscle is found only in the heart. A joint is the junction between two or more bones. Free-moving joints or diarthroidal joints make up most skeletal joints. They allow certain movements, the surfaces of which diarthroidal joints are covered with hyaline cartilage, which reduces friction during joint movement. The space between is the joint cavity, which is enclosed by a fibrous capsule lined with synovial membrane. This membrane produces synovial fluid, which acts as a lubricant. As you see in this little box table here, you'll see it says synovial joints, and then the various different joints here listed. So you'll see that the characteristics of the synovial joint is that it's immovable. An example is at the suture line of the skull between the temporal and occipital bone. And then you have the diarthroidal joints, which are also called the synovial joints. They move freely. And then you have the gliding joints like the fingers, the hinge joints like the elbow, the pivot joint end of the radius and the ulna, the saddle joint between the wrist and the metacarpal bone of the thumb, and the ball and socket like the hip joint. So there's different examples of the joints. So this graphic here just gives you the examples of the different joints like the gliding joint, the hinge joint, the pivot joint, the saddle joint, the ball and socket joint. And then with it, it just gives you examples of the joints. So for hinge joint, we have the elbow joint, the knee joint, the ankle joint. The ball and socket joint, you have the shoulder joint and the hip joint. Tendons are cord-like structures that attach muscles to the periosteum of the bone. A muscle has two or more attachments. One is called the origin and is more fixed. The other is called the insertion and is more movable. When a muscle contracts, both attachments are pulled and the insertion is drawn closer to the origin. An example can be found in the bicep of the arm, which has two origin tendons attached to the scapula and one insertion tendon attached to the radius. When the bicep contracts, the lower arm moves towards the upper arm. Question number 2. Is the following statement true or false? Tendons attach bone to bone. The answer is false. Tendons are cord-like structures that attach muscles to the periosteum of the bone. Tendons connect muscles to their corresponding bone. Ligaments consisting of fibrous tissue connect two adjacent, freely movable bones. They help protect the joints by stabilizing their surfaces and keeping them in proper alignment. In some instances, ligaments completely enclose a joint. Cartilage is a firm, dense type of connective tissue that consists of cells embedded in a substance called the matrix. The matrix is a firm and compact, thus enabling it to withstand pressure and torsion. The primary function of cartilage are to reduce friction between articular surfaces, absorb shocks, and reduce stress on joint surfaces. Hyaline and articular cartilage cover the surfaces of movable joints such as the elbow and protect the surface of these joints. Other types of cartilage include costal cartilage, which connects the ribs and sternums, semilunar cartilage, which is one of the cartilages of the knee joint, fibrous cartilage found between the vertebrae, elastic cartilage found in the larynx, epiglottis, and outer ear. A bursa is a small sac filled with synovial fluid. Bursae reduce the friction between areas such as a tendon and bone and tendon and ligament. Inflammation of the sac is called bursitis. Question number 3. Is the following statement true or false? Ligaments attach bone to bone. The answer is true. Ligaments attach bone to bone. The connection is of two adjacent, freely movable bones. So now this comes down to the time to take our assessment. And to begin with, we'll focus on the history. And this will depend on whether the client has a chronic disorder or a recent injury. And there are symptoms that are common to the musculoskeletal dysfunction, no matter whether they are acute or chronic. And so these symptoms include pain and altered neurosensory sensations. And so assessment of pain and neurovascular assessment, these are a priority for clients with any musculoskeletal disorder. So if the disorder is long-standing, the nurse needs to obtain a thorough medical, drug, and allergy history. If the client is injured, the nurse needs to find out when and how the trauma occurred and compiles a list of symptoms that include information about the onset, duration, and location of discomfort or pain, determining whether activity makes the symptoms better or worse, is always important, right? And so the nurse also identifies associated symptoms if there's any like muscle cramping, skin lesions, and ask how the problem interferes with activities of daily living. If the client has an open wound, for example, you need to find out when they last received a tetanus shot. So if they have any like foreign body, stepped on a nail, they'll need a tetanus shot. So you also need to obtain a history of any past disorders and medical or surgical treatments. And paying attention to any chronic or concurrent disorders, such as like diabetes, is really important. Because if they have a foot injury or laceration to the foot, if we look at the foreign body to the foot, if they have diabetes as well, they're going to be a poor wound healing to the lower extremities. And so this will, complicate their plan of care. So we need to keep that in mind. In addition, you also need to ask questions about family history. If they're having, like phantom pain in their legs, heaviness in their legs, finding out if they've had family that have had some same symptoms, if there's maybe possibly, finding out what they do for a job. It could be an occupational history. Also taking note of their, asking questions about their nutritional status, because this can also play a role in their nutritional health. And then you'll move on to your physical examination. So for a general musculoskeletal assessment, the nurse observes the client's ability to ambulate, sit, stand, perform activities requiring fine motor skills like picking up objects. Then a general inspection, you'll kind of like look for symmetry and size and contour of extremities and random movements. Hopefully you can take a look at the spine and look for like the spinal curvatures. The nurse can palpate the muscles and joints to identify swelling and the degree of firmness, if there's any local areas of warmthness. You'll test the client's muscle strength. You'll apply some force to the client's extremity as the client pushes against that force. You'll perform a neurovascular assessment where you assess the range of motion of the joints, but you don't want to force any movement, right? So you'll note any abnormal muscle movements, such as spasms or tremors. You'll also look for any abnormal size or alignment and symmetry comparing one side with the other. You'll inspect and palpate for pain, tenderness, swelling, and redness. You'll observe any degrees of movement or range of motion, but again, you're not going to push the joint past any kind of pain. You'll test muscle strength and inspect for muscle wasting. And then depending on symptoms and findings, additional assessment may also include looking for changes in gait, posture. Maybe they may favor one side over the other. They may not be able to bend and twist at the trunk. So it's essential to assess clients for musculoskeletal changes because of their potential impact on activities of daily living. If the client has a traumatic injury, physical assessment always will begin with vital signs. And you got to kind of think your ABCs, like airway, breathing, circulation. Just because they have this traumatic injury, you always need to go back to ABCs. So airway, breathing, circulation. Make sure all that is care, and then you can care for the injured, what brings them in. Further assessment depends on the type and area of injury. So as the nurse conducts her assessment, you need to maintain standard precautions. So if there's a large amount of bleeding, you may need to wear, gown, goggles, things like that. You may need to cut away clothing around the injured area so that you can visually inspect the client. You want to compare structures and assessment findings from one side of the body to the other. Although the nurse must be thorough, it's also important to be gentle and, taking care of pain, You want to observe for swelling and external bleeding or bruising, palpating for pulses, evaluating peripheral circulation, assessing for pulses, skin discoloration, capillary refill, checking the sensation of the injured part, looking for any broken skin or open wounds, superficial or embedded debris, protrusion of bones, examining for injury beyond the original area. For example, if you auscultating the chest and abdomen, if it's in an abdominal or thoracic injury occurred, or checking the pupils and mental status if there was a head injury, looking for any malalignment of the injured limb, assessing for pain and noting the type and location. But note that the physician needs to examine the client before the nurse touches, cleans, or disturbs open wounds and before moving any injured extremity. A bone scan uses the intravenous injection of radionuclide to detect the uptake of radioactive substances by the bone. A bone scan may be ordered to detect metastatic bone lesions, fractures, and certain types of inflammatory disorders. The radionuclide is taken up in areas of increased metabolism which occur in bone cancer, metastatic bone disease, and osteomyelitis. Nursing considerations for preparing a client for a bone scan include informing the client that the radiopaque isotope will be administered intravenously, ensuring that the client does not have any allergies to the isotope, informing the client that the scan will take about 2 to 3 hours, encouraging the client to increase their fluid intake to distribute and eliminate the isotope, asking the client to void before the scan. An electromyography tests the electrical potential of the muscles and nerves leading to the muscle. It is done to evaluate muscle weakness or deterioration, pain and disability, and to differentiate muscle and nerve problems. The physician inserts needle electrodes into selected muscles and uses electrical current to stimulate the muscles. Then they measure the response to the electrical stimuli. If the client experienced discomfort after the study, they may place warm compresses on the area to help relieve the pain. A biopsy is done to identify the composition of the bone, muscle, or the synovial fluid. The specimen may be removed with a needle or excised surgically while the client is under general anesthesia. Afterward, the nurse observes the site for signs of bleeding or swelling, assesses for pain, applies ice to the site, and administers analgesics as indicated. If the client has a chronic disorder, the nurse obtains a general medical history, a description of the current symptoms, including pain and disability, and compiles drug and allergy histories. An allergy to iodine in seafood may be a contraindication to performing an arthrogram or other test in which contrast medium is instilled. If the client has had an invasive joint examination, the nurse inspects the area for swelling, bleeding, or serious drainage. He or she changes or reinforces dressing as needed. If the client has severe pain in the area, the nurse must notify the physician, who may order an application of ice or pain medication for discomfort. In the case of a traumatic injury, the nurse obtains information regarding the injury from the client, the person accompanying the patient, or paramedics and ambulance personnel. They take the vital signs during the initial examination and at frequent intervals until the client's condition stabilizes. The nurse also checks the neurovascular status of the affected limb, including circulation, motion, and sensation. Keeping the client calm and promoting comfort are essential measures. This concludes Chapter 60, Introduction to the Musculoskeletal System. If you have additional questions, please reach out to your instructor.